Well, hello, everyone. Welcome back to Sama Saturday. This is Sama Dog's monthly show, actually, that we now air every first Saturday of the month. And we come together here to discuss health and well-being for our animals, especially for dogs, because, of course, that's Sama Dog's big focus. But so much of this that we will talk about today and always apply, including the human animals on this planet. So it does make talk about these techniques because it can help so many of us. That is absolutely the mission of myself, this work, and everyone on the line here today. So let me do a few introductions and we'll dive right in. My name is Amanda Ree. I'm the founder of Sama Dog, and I am an Ayurveda meditation and yoga practitioner. I absolutely love and absolutely feel that it's my reason on this planet is to bring this information to all of you, not only through what I've learned myself along the way, and I continue to learn, but really feel strongly about creating a platform that all of these amazing practitioners, three of whom are here before us today, to share their knowledge and their wisdom and their great amount of experience and the impact that they've had on animals all around the world. So that's what Sama Dog is all about, and Sama Saturdays will continue on to share the message in this way. Today, the focus of our show is all about alternative therapies for dogs and all other animals. And we are joined by, as mentioned, three experts in their fields. We have Chiara Marrapodi on traditional Chinese medicine, and the specialty today of acupuncture, or acupressure, that's what she'll speak about. And then Dr. John Harrison is a chiropractor for humans and animals. Today he'll be sharing with us about VOM, Veterinary Orthopedic Manipulation, which he is an expert of, and he also treats humans, so he can certainly have that conversation for all of us. And then we have the amazing Joan Ranquet, a dear friend, as she is going to share on emotional freedom technique for animals, which is also known as tapping. Some of you may be familiar with that healing technique for human beings, but I hadn't known until actually Joan's student opened it up to my eyes that animals can receive so much benefit from that as well. So all of these alternative therapies, as it's called, are so helpful and pretty familiar, but maybe not as familiar with how they apply to our canine companions. So that's what we're going to dive into now. We encourage all of you to share, to engage with us. Let us know that you're here, first of all. We'd love to hear who you're sitting with and where you're watching from. And as we go along and questions come up, don't hesitate at all. Put them into the comments. We will definitely have time for questions and answers at the end and a few throughout the show too. So don't be shy. All right, so Chiara, we're going to start off with you, my dear. She is an advisor, scientist, researcher, spiritualist, and conservationist at heart. She communicates animal wisdom to all those that know her. She has had close associations with the natural world since her childhood. After growing up in Zimbabwe, Africa, her family had many types of different animals, and I look forward to hearing more about that for sure. Chiara teaches on many incredible topics. I've had so much fun on her website learning about the wealth of information that she is and shares. But today I've asked her to share with us more about traditional Chinese medicine and how it applies to our animal friends. And as I mentioned, she's also going to share with us the specific conversation of acupressure, what that's all about under that umbrella of traditional Chinese medicine. So I'll turn it over to you. Please let us. If you have so much awareness of so many of these, just kind of share with us first, Chiara, what do you think about this alternative therapy in general, how it can help animals, and then share with us more.
Thanks, Amanda, and thank you so much for having me on your show. This is really amazing to have all of us here to share the different streams of knowledge and educative information that we all have, and it's unique to us. So this is a true blessing and honor. And, you know, in terms of alternative therapies, and I'm going to focus on traditional Chinese medicine, it really is a holistic view of the body, mind, and spirit. And it goes for humans and animals, although we are focusing on animals. And it really brings us to the understanding of an organic type of thinking. And an organic type of thinking really marries knowledge with beingness, with feeling. So the felt sense, the sense of feeling in our body is very much a part of the traditional Chinese medicine umbrella, because we're bringing the body, mind, and spirit into the energetics and not just the physical, which has been the most prominent ideology that we've had to date. So under the auspices of traditional Chinese medicine, I do want to say that it's a very large topic. So it's not something we'll be able to take into account at this point in its totality. But what I'd like to say is the reason why I find it so amazing with animals is because they're so receptive. Animals, when it comes to acupressure, they know that you have an ability to see inside of them, to feel them, and they'll gravitate to that. They'll give you information right away. It's real time. So let's take a little journey through a very brief understanding of traditional Chinese medicine. So traditional Chinese medicine is very old. It's thousands of years old. And the premise of it is that the energetics of the body actually are related to internal organs. And these organs are represented in 5-element theory, which means, so the 5 elements are metal, water, wood, fire, and earth. And each organ is related to one of these 5 elements. And these elements have many different relationships, not just internally with the body. The beauty of traditional Chinese medicine and acupressure is that the environment is taken into account. So let me give you an example. For example, there's what we call the 5 phases of transformation. So we have the 5 elements, and within each of the different organs, they can be yin or they can be yang, and they're paired. And there are 12 main meridians, and these are also paired. So you can see there is a beautiful relationship, and it's a bidirectional relationship. There are cycles, there are rhythms, and this 5-phase transformation information based on the 5 elements and the organs and the meridians are all married together. So you can sense that even though we have a brief time together to talk about this, it really is quite complex. So let me give an example, and we're going into spring right now. So spring is really about the wood element, and it's about birth. And in terms of climate, it's about wind. And if we look at direction, it's the east direction. The color that is related to springtime is green. The organ that's related to springtime is liver and gallbladder. These are the paired organs and meridians that are part of the wood element during springtime. So what is believed and what they found is that during this time, we would strengthen wood because it's spring. We'd like to amplify the wood element at this point. And what's really quite amazing to me, and I see it with the animals, I'm going to give some examples in a minute, but they really do show very similar emotions to humans when it comes to the emotional pairing of not just the 5-element cycle, but the actual meridians themselves. So in this instance, with relation to the element of wood and the organ of liver and the meridians of liver and gallbladder, the emotion is anger. And so when we do an acupressure session, the way that we do it is we ourselves go into a meditative state. And this is where the organic thinking comes in for me. It really isn't thinking. It's more of a state of being married with the knowledge of the traditional Chinese medicine. And when we do that, we present ourselves, in this case, to an animal, and we request permission to actually do a session with them. Because it is a co-creation when we come from this perspective and this type of therapeutic understanding, and for the ability for this particular acupressure therapeutic or alternative therapy to be most effective, it is definitely a participation between the practitioner, their ability to sense, to smell, to see, to intuit, and to feel. And, so it's a science and it's an art. It's not just having the knowledge. So, for example, I have a beautiful racehorse, and she had PTSD, and we used a whole host of different types of modalities, and acupressure is one of them. And, in real time, horses will move, animals will move, just to tell you, oh, it's this one. Oh, no, we're finished now. Go to the next one. I've had this. And they also will do an integrative process where they'll get up and they'll move around. They're integrating because the chi now, which is energy in the body, is moving and flowing, because what we've done is we've allowed that point to be changed, transformed. So if there's any blockage in there, it's released. If we need to increase the energy at that point to fill it up, so to speak, in simplistic terms, then that happens. The body is intelligent. And once we have these tools and we bring them to the animal with all that we know and all that we are, then we're able to effect change very quickly. They yawn. As I said, they move away for integration and come back. They manifested externally through yawning. Through even defecating sometimes. I know it sounds a little odd, but the body, that means that the bowel is moving. And in most instances, what I've noticed in my work is, for example, the earth element related to spleen and to stomach is the one that I work with most, and the lung and large intestine, which is related to metal. I'm giving you some context so we start to build a picture and understanding of what traditional Chinese medicine is in terms of acupressure. So, there are many different ways that the animal will show that they're releasing what they need to release. The pent-up emotion of anger, for example, or joy in relation to the heart. So that really gives you a contextual idea relating to acupressure, its use, and the underlying fundamental of the traditional Chinese medicine under which it's created. Acupressure really is the most amazing experience for a practitioner and an animal and a human. I don't want to keep them out of the picture because, as owners of the animals, they are part and parcel of the relationship with the animal, the practitioner, and in relationship with the outcome of that for both of them, because inevitably everyone is connected. And the reason why I resonate so much with this wonderful tradition is because of the connectivity between the human, the animal, the environment, because it's such an important piece. Mm-hmm. So I hope that this gives you an understanding of what traditional Chinese medicine is on a very simplistic level, and how acupressure animals, dogs, cats, horses, and beyond.
Mm-hmm. Yes, it's fascinating, and thank you, because thousands of years of knowledge and history is not easy to sum up into 10 minutes, but you did a really great job, first of all. And
thank you. Thank you very much.
And you really start to see the way, most importantly, what you said, that everything is so interconnected and everything affects everything
Absolutely.
else, inside and outside the body. One quick question here, Chiara. Lola says, Amanda, is there a simple Chinese medicine chart with the elements, colors, meridians to show simply what is connected to each other?
Yes, if you Google that, absolutely, you'll be able to find multiple ones. It does go a little bit deeper than that in terms of understanding how to use them, of course. But as a first point of reference, please, of course, Google, you'll find that.
Mm-hmm. Mm-hmm. Great. And that's always something nice to just have, to reference. And
absolutely. So they can begin to understand, certain smells are related to certain organs and certain meridian lines. So going back to the wood element and the liver and the gallbladder, it's a very rank smell. So when I go and do a session, I will use all of that. I will smell the animal. I will even ask to look at if it has any, like a horse might have defecated. I will go now look at that because it'll tell me, does it smell like there's damp? That means we might have a fungus, potential for fungus. And I've done that in the past, and it's amazing what comes out. I said to the lady, how long has your horse been on antibiotics? She goes, how did you know? And I said, because I can smell it.
Wow.
So that's the science and the art of really, it's smelling deeply, not just superficially. And so it's pretty amazing.
It is. It's fascinating. And I have
Very
put up
much
here
so.
on the screen wildvoicestalk.com. That's where you can learn more and see all of the wonderful things that you do. You really blend together, Chiara, many different modalities, all holistic based, all
Yes.
weaving together all areas, all elements, like you just shared. But to find them all within one practitioner is pretty rare. So I love it, and I
Thank
look
you.
forward to learning from you
I
more.
was very well educated in Africa, I have to tell you, experiencing the animals and, growing up in that type of environment, because you're so related and connected to the earth, and so that really was the beginning of all of this. It's been an amazing experience. I'm glad to be here.
Well, thank you. Thank you so much for sharing your heart.
Thank you.
So now we're going to shift over to Dr. John Harrison, just below there in our little, what is it called? Jeopardy squares. Dr. Harrison is a human chiropractor, as I mentioned, located in Encinitas, California, the hub of greatness, since 1976. And since 2009 has been a veterinary chiropractioner practicing what's known as VOM, Veterinary Orthopedic Manipulation. If you've never heard of this, you don't know what it is, that is exactly what we're going to learn. His work with animals, which consists of dogs, cats, rabbits, and horses mostly, is done through VCA Acacia Animal Hospital and Pet Resort in Escondido, California. Humans over in Encinitas, animals over in Escondido to find Dr. Harrison. He is a deeply spiritual man as well, having just shared with me that he's been practicing meditation for almost 50 years. We share connections to our teachers and friends, Dr. Chopra, Dr. Simon, and the amazing Paramahansa. So very much, tying together his spiritual path and that connection to the deep soul work into his work with animals and the physical body. So we're excited to have you, Dr. Harrison. Please go ahead and take us from here and tell us first, how did you get into chiropractic for animals coming from humans?
Well, I've had a long road, a very interesting road. I actually started in the Navy as a corpsman during the Vietnam War. And then I became a chiropractor in 1976, as you said, and I've been practicing. My daughter's a veterinarian technician as well, and I always thought it'd be fun to work with her. So I went and I looked through the archives and also the seminars for something that would work not only with the premise of vertebral subluxation and muscle imbalance with the veterinarian profession. And I found this wonderful doctor of veterinarian science, Dr. William Inman, who teaches veterinary orthopedic manipulation. So I took his courses a couple of times before I started actually working. And I came here to Acacia Animal Hospital and I demonstrated what I could do. And I was also looking for a certification program that they would certify me so that I could be officially recognized, so to speak, to have an integrative approach with a musculoskeletal way with our medical profession and our medical chemistry. Well, I lucked out because not only did I get accepted here at the hospital, but I met the most fantastic doctors of veterinarian science as well that I work with. So we don't just have an alternative approach, we have an integrative approach where we actually depend on each other to really work with each other when we have these situations, whether it's a rabbit, a cat, a dog. I have done horses on the side, but basically, as you were saying earlier, this is pretty much a dog world. So I do a lot of work with dogs. The whole thing about our spinal system is that we have a brain, we have a spinal cord, and we have all these vertebral segments that are influenced by what is happening with the activity of the muscle system. Every time we have any kind of situation where we have weakness or an old injury, or now we have an older dog that is suffering with some arthritic situations, first you will find muscle tension, because that muscle tension is guarding the joint surface, or it's guarding the nerve root itself. In that contraction of muscle tension, we start to see distortion. Once we see distortion, we start to see that the impact that it might be having on other parts of the body, especially in the upper limbs, if it's a low back problem, or if it's a neck problem from people jerking the leashes too hard, you'll start seeing problems in the lower back. One of the key evidence signs of seeing any of our animals suffering, even on our rabbits, you find a lot of heat in that muscle tissue. That muscle tissue is crying for blood, it's crying for oxygen, and it's crying to be released from the amount of tension that's being exerted on that joint. And this is what then starts to compress the nerve root, going to an organ perhaps, or to another group of muscles. If it's a group of muscles, we're going to have sensory deficit, we'll see muscle atrophy, or we'll see a lot of pain. Sometimes we see both, but sometimes you'll actually see different nerve roots are going to be causing different problems. If we have an organic problem where the organs are being impacted, you're going to have fatigue, you're going to have weakness, and you're going to have lethargy. And all these things are saying, I can't move, I don't want to move, and I don't know what's going on. This is where our animals especially tune into the owners. They really are looking to us for guidance. They don't go into the emotional friendly like we do, but they go, what can I do to get myself moving again? Remember, movement is the key. And one of the big things that I look for in all of our dogs especially, can they shake from the nose to the tail? If they are blocked somewhere along the spinal musculature or somewhere in the neurological bed, they are going to only be able to shake to the neck, or maybe to the shoulder, or maybe to the mid-back. And this is what gets really, really a good visual aid for me when I first start working with them. I watch gait, I watch how they jump, I get the history, of course, but then I start going into palpation, and that's what I'm looking for, is all this muscle distortion and all this biofeedback. You'll actually see the muscle twitch when it's in a contracted state. It's saying, I'm so tight. If you just put pressure on that trigger point or even on that acupuncture point, you're going to see an anatomical physiological reflex. We call it the panniculus response. And it actually shows the skin just go like flicker. These are the things that give us the idea, okay, we've got segmental problems as well as long muscle problems. We as humans are walking on two legs. So our center of gravity is in the lower back, right on the sacrum. Everything's pivoting around that one area. Well, our four-leggeds, their center of gravity is right where the rib cage ends. And this is why you'll see a dog, they'll hump up, we call it roaching, or they'll start sagging because of overweight or not working the muscle tissue anymore. And so you know that these spinal muscles are being so impacted. And again, the stress level on our canines especially, they start slowing down, and we go, well, it's just old age. Well, no, it's all sorts of things, but it's affecting movement. It's affecting mobility. Remember, in a dog's mind, they're athletes. They want to play. They want to jump. They want to get that ball. They want to perform. And when they can't, when they start withdrawing and when they start whimpering or showing some extra stress on their system, that's when we suffer and we go, what else can I do? So in our office, we do an assessment and we work together. Yeah, we might need those pain relievers. We might need some muscle therapy, relaxants. But we have access in our office. We do a full-on muscle therapy, massage therapy. We do adjustments. Now, I don't do the hand adjustments with VOM. What we use are these little instruments here. This is called an activator, or here it is, an arthrostem. And what it does, we can put it on the dog's spine. Well, there we go. And we can create impulses into those joints without creating any kind of mechanical stress with my hands. So some people like to call this technique animal chiropractic, but in reality, chiropractic means doing my stuff with hands. That's what I do with my humans. So I do a lot of muscle therapy with my hands, my massage, etc. But here we use instruments because, again, we have a very small spinal system, especially when I'm doing rabbits. There's no way I'm going to hand manipulate a little rabbit. So we have this ability. We also have this is a vibrocussor, and what this does is creates a compression into the muscle tissue. Let's see right here. Where's my, I'm sorry, there it is. So we'll use this again to decrease the chemistry pain that's left behind from injuries. And that's the stuff that when you touch it, the dog will react or actually, show you, hey, that hurts. Don't touch too hard. So that's a chemical aberration due to the muscle contraction, due to the muscle failure. And so all that muscle contraction is doing, though, it's guarding itself, but it's calling on other muscles to help it out, to help stabilize the walk or help stabilize the dog itself. And when those get tired, now you have a whole cascade of events creating a lot more problems and a lot more distortion. And so it's really a great science because basically, again, what we're doing from a biomechanical approach is we're increasing blood flow. We're decreasing the chemistry that's creating all this pain. And we're also increasing the ability to move again. We want to see that movement. There are so many times after I'm done working on even dogs that come in here with hip syndromes, low back, I want to watch when I'm done that dog will actually reshake from the nose to the tail. We want to see that. We also want to see where the tail comes up and starts to move again sideways, wagging. We want to see where the ears settle down and the eyes, they go from this and they drop down into that relaxed endorphic look. These are the ways that we see that the technique is working well. Usually on the first treatment, any animal will want to sleep. And so we'll have them relax. And our acupressure person, Chiara, she probably sees the same thing. They get so relaxed that the body wants to get rid of the whole motor involvement and start to withdraw a little bit so that the body can start restore itself and heal itself. And this is what's so beautiful is because we just set the animal in motion and they heal themselves. It's really great. We're kind of like doorways to them re-engaging their life force to turn back on. Okay. So I do a lot of work with our dogs, of course. One of the things that I don't see is a lot of people think, oh, my cat's got 9 lives. I'm not going to bring in my cat too often. Well, cats are really, really keen on getting this work done. That vibrational machine I showed you called the vibracussor, they think of it as a purr machine. So they start actually relaxing and purring while I do the technique. Rabbits, when they feel really, really good, remember they're a predatory animal. They're a prey animal, I mean. When they feel calm with me working with them, they'll start grooming because they're going, keep it up, doc. This is really good. Our dogs, they just go into a relaxed state. Out of probably, 1,500 dogs in the last 10 years, 11 years of me doing this work here, I've only had to muzzle maybe 6 or 7 dogs. The technique is so relaxing and it's so engaging to them. And I have all my patients, the owners, in the room when I do the work. So not only am I working on the animal itself, I'm educating my patients, I'm educating the families. The kids are watching this, and we start to see that, hey, there's another way to help our animal. Yeah, there is another way. And so this is why, again, I like to work with the other professions. I had a background in the medical profession as a Navy corpsman. I worked at a couple of hospitals before I became a chiropractor. And then when I went to chiropractic school, I worked in an orphanage and was child care counselor for 4.5 years. And then I came back and raising 2 children, and now I have 3 grandchildren. I mean, it's just been a cascade of wonderful, wonderful events. And I have to, again, if you get interested in this, you can go online and look up veterinary orthopedic manipulation. Go to Dr. William Inman's website. He's a veterinarian, DVM. And he will give a thorough background. And there are a lot of different videos and a lot of different talks. But he's really, really helped the understanding that how much we can do as professions working together rather than isolating one profession against another profession and not thinking about the integrity of the animal itself. So I could go on and on and on, but where are we at with our time?
Yeah, no, it's really great, everything that you shared, and you're so right on. I'm glad you landed there. And that's kind of what I said in the beginning when we started out. Certainly my intention with Sama Dog is to help create a platform like this, like Sama Saturdays, but also just in conversation and communication, connecting one another, giving referrals. We're all talking to lots of different people with their animals every day. And
Yeah.
so we together can help heal them, and every single being is uniquely individual and their issues are individual. So it depends on what's going on with them to what they need. And having this amazing network is what it's all about, and understanding these concepts. That's why this conversation is so important. I bet
Yeah.
many people watching didn't even know that this was a possibility for animals.
I know, and it really does get mixed up sometimes when they think, oh, you're a chiropractor, you're going to do a lot of crazy manipulation of my dog. No, that's almost, you put your hands around a dog's neck who's in pain, like you're going to adjust his neck. He's like thinking, this guy's going to bite me.
Yeah, yeah,
So
I bet.
you have to really allow the dog to come to my space and really recognize that what we're going to do is going to be very soothing and very relaxing, and also very caring for that guy or that girl. And they just go into a total relaxed state. It's great.
I bet that is a reward of every patient that you get to see. I loved hearing about what bunnies do when they're calm, because you don't know. I thought maybe their little noses wiggled faster or something.
We have a large group of people in the San Diego area called the House Rabbit Society. I work hand in hand with them on a lot of things. And kids will drop their rabbits. Rabbits will get startled and crash into furniture. So you're thinking, what are you going to do on a rabbit? Well, when you see a rabbit with a head tilt, or when they can't walk very well, they need musculoskeletal care. And, just because they're tiny, they hurt too.
Yeah. Oh, that's so good. Thank you so much, Dr. Harrison, for sharing all of that wonderful information. We put up on the screen, and I'll definitely put into the comments, where you can find all of our practitioners and learn more, meet with them directly, or whatever it is that would help your animals most.
Thank you for this.
All right. Yeah.
Wonderful.
Thank you. So now we're moving over to Joan. This is Joan Ranquet, as I mentioned a little bit earlier, but just a little more formal introduction, that she is a professional animal communicator and wellness practitioner for almost 30 years. She is a TEDx speaker, so look her up. It's a great talk. I've watched it many times. And well-known Hay House author and educator. She is an advocate for animals all around the world, helping tens of thousands of them to be heard and understood better. She's featured in so much media that the list was too long to list, and she has trained over 10,000 animal communicators worldwide. She offers live and online courses, wildlife retreats, and private sessions. And each year, also, she is featured as one of our guest educators in Total Wellbeing for Dogs, our 6-week online program. So we'll be coming together again for that. So I just wanted to let our audience know, so you had that association, or maybe some of you have taken the course and you recognize Joan from that. So Joan, first of all, welcome. Thank you so much for being here with us.
Thank you for having me. And that was so fun to watch, right? Both of what the other guests have shared is so amazing, and such a perfect lineup for then what I'm going to talk about with the EFT, Emotional Freedom Technique. So
so dive into it.
Yeah. As an animal communicator, I often would see situations where somebody was afraid to go walk their dog because maybe their dog had been attacked, and now their dog is the dog that's attacking. Or another very common thing, I also am a horse person, and I would see people get dumped off their horse and afraid to get back on. And at some point in my own life, in about 2001, I was victim of a crime. And so in order to sleep and to get over some things, I had EFT done to me. I was the recipient of it, Emotional Freedom Technique. And I thought it was so cool that I thought, what if I were able to help people get over the fear that they carried in their body, that then translated in the leash, or that was their sits bones when they're in a saddle. What if I could help them get over fear when with events that they were trying to do with their animals. And so at first I was, so I got certified in about 2002, and I was really only working with the people at the time, and helping people get over their fear. And so what it is it's tapping, and we have had this in the introduction to, it's tapping on acupressure points. And those acupressure points are connected to meridians that are connected to the organ system that are connected to an emotion. And so it's releasing, and going back to what, Dr. John was saying, that there's this whole, when you think about that bunny crashing into the furniture because it was afraid, animals are constantly in the fight or flight mode, or can be, not relaxed. So there's often an emotion attached to what's going on physically for them. I've had such an amazing introduction to this work. So anyway, at first I only worked on the people. And then one day, this horse trainer, a friend of mine, I was living in Florida at the time, he called me and he said, "You've got to come out here right now. This horse is going after ponies in the warm-up ring at a horse show in Wellington, Florida." And I was like, "Well, I can do this on the phone." And he's like, "No, you've got to get out here." So I canceled my other clients, went out to the horse show, saw the scariest looking horse that I've known, client's horse that is so lovable and loving, going after ponies. So took him away from the crowd, obviously, because he was scaring little girls, and had him. I communicated with him, and I found out why he wasn't, why this was going on. He had been thrown out into a field as a young horse with a bunch of ponies. And at that point, he was teeny, but he grew into being his big self, and still was terrified of ponies. So he was going to go after them first. But in order to get them back into the arena, it wasn't enough for him to communicate. He still had this terrible need to go after the animals. And I thought, what the heck? I'm just going to do this. I'm going to do that tapping thing on him. And so in 2004, I started tapping on animals. And ever since then, it's been so fun, because like Chiara was saying earlier, the whole idea that they lick and they chew, you see the release right away. And like what Dr. Harrison was saying, like their eye might relax. Like you see the expression change almost immediately. They might poop, they might, pass gas, all those things. But what's so great about EFT for animals is that the animal may have a certain anxiety about, like, say, a dog going back outside or going to that same park where they got attacked, and the person has the anxiety. So to be able to have a technique that you're able to use on both the person and the animal is an amazing, 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 powerful release for both of them. And when we have anxiety, it gets translated in the leash, and when the animal, or it gets translated into the saddle, even the lead rope if you're just on the ground with a horse. So, and cats. I mean, I've tapped on cats. I've tapped on bunnies. I've tapped on fighting bunnies. So anyway, and then the bunnies could never be together. And after we did a tapping session on both the bunnies, they lived together happily ever after, and actually we're a couple. So it was very, I think the lady doth protest too much. It was one of those things. She was pretty, unhappy with him, but eventually they lived together. So it's really, and I have an amazing story. The other day I brought in a new horse, and one of my horses was really, really, really just so bitchy and mean. And for a couple of weeks, it was like going on way longer than I thought it should. And I finally got that she was grieving my other horse that died 4 years ago. So I tapped with her just once, just did a whole round of tapping on how, change is hard. And this guy, who is this stupid new horse? And okay, eventually getting, he's kind of cute. now they're all best friends. And I mean, you can't make this up, right? It's so immediate. And again, like both of the people speaking before me, a lot of emotion is trapped in the body. So I like to think of EFT as almost like an emotional, an energetic body work, right? Like it's an energy work, but it's also a body work. And I really believe with animals, they need the touch, they need the physical, that's almost on some level, physical contact helps release almost more the emotion that's trapped in the muscles or the body is almost more important than sending remote energy work. And it's something that people can do at home. Mm-hmm. So I've got a ton of videos up on it, but Delilah, you're on.
And that's good to know, Joan. So I'll post one of your videos also, just for more reference.
Yeah, the 4th of July one is the best one. I think I'm probably wearing the same thing. I'm kidding. I'm not wearing this. But, anyway, so what I'm going to do, let's say you have a behavior that is not something you love, right? Like at some point, one of the things, I did a lot of dog training, changed diet, did a lot of things, but she was reactive to other dogs for a time, and we did training and tapping, and we overcame it. So I'll just demonstrate a little bit. So there's some specific tapping points, and they so that's basically what I'm doing. So let's pretend that she's still reactive, like I'm so afraid, I'm so afraid, I'm so afraid. Back over here, my friend. I'm so afraid. I don't like other dogs. I do like other dogs, but I don't feel comfortable. I don't feel safe. 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 All right, I'm going to start trusting. I'm going to start trusting. I'm going to start trusting. I can trust. I can trust. I can trust. I can trust. And in this situation, she didn't have a lot of visible releases, but she's not somebody that necessarily gives that up so much. But I could feel a certain change in my own breathing, and I take that as a time to make a transition for the animal. And I've had so many dogs that I've done this with that have been reactive. And again, you still have to do dog training. You may still want to go have a VOM treatment because you've had to pull on the leash a lot when a dog is reactive. But it's a very powerful technique on its own, and also to be used with training or with diet change or with these other body works. It really releases the emotion out of the physical body and helps a lot with the PTSD of situations. So,
because essentially, Joan, that's what it's doing, right? It's the memories get lodged within our cell memory, and this is allowing that memory to let go.
Yeah, I mean, you and I can get on the phone and say, "Oh my God, this happened," and I can download, and then I can call my other friend and say, "Oh my God, this happened," and for them, it gets stuck in their body. And that's why, I studied acupressure years ago. I'm not a practitioner now, but I know enough about it to see so many places where it's so helpful to release the emotion and the physical pain, because for animals, it's their body expresses their emotions.
Mm-hmm. Absolutely. And Joan, just refresh us again. I think, I'll definitely post the video that you mentioned, and we can probably get a little more into seeing where you're touching. But just tell us again, where is it that you're touching on the animal when you're tapping?
I know, I was trying to find a chart earlier, but I have a chart. I'll see if I've got a chart somewhere. But it's inside of the eye. So it's that bladder 1, right? And then it's outside of the eye, under the eye, on their nose, under their chin. And then there's a place in their chest that's K27 which is a good restart for all the organs. But I also, and I know that I have a professional here, so I'm being respectful, but I actually, on an animal, I like to also get the lung one if there's grief involved. So I actually don't touch a point, I touch a few points if they have a smaller chest. On a horse, I might tap up from K27 to lung 1, and then the top of the head.
Mm-hmm. Wow. Yeah, it's really fascinating. I did this with Kate Doyle, one of your wonderful students, and I was working with a dog that had severe aggression issues. She was extremely abused when she was young, and trying to get her to release that experience was very difficult. And I remember, like you said, the immediate, well, like all of you have said, really, the immediate impact and the release or the way in which they respond was pretty phenomenal. This dog did not really like to be touched, and she would just fall into it. Kate was on the phone a few times guiding us, doing kind of the script, so to speak, and guiding us on the experience. And we would watch her, like her head would go back and then fall over. And other than that, that dog was like really tight. It would never really lift its head up because it was losing control. And yeah, she would get all loose and gooey. It was nice to see her like soften finally. It worked.
Yeah, it's magical. I did it on a cow the other day at the Gentle Barn. So I mean, it's so amazing to be able to watch them release like that and
Wow.
experience the emotional freedom.
Yeah.
And
yeah. Hey,
the one thing.
Yeah, go ahead.
Oh, I was just going to say that, when you first get started, I always remind people it's not intellectual freedom technique. So you don't have to get all caught up in your head how the script goes, You just need to really like pick an emotion and start tapping. And literally it's like you're tapping away layers. So.
Oh my gosh, I love it. Well, thank you, Joan, for all of the great work that you two put out into the world and have shared with so many of us. Let's see if we have some questions. I was so enthralled in the conversation, I wasn't even looking over there for a few moments. So let's check it out. Let's see. Yeah, so this is Trish just saying here that this is also amazing. So much helpful information. Thank you. I'm definitely going to start adding in the tapping on Vita. Yeah, that's her dog, that Trisha's dog, that has just some tendencies, like we said, that she, she's a rescue, so she definitely has some stuff to let go of. So Tina Macros, she's so awesome. This is one of our friends and trainers that's been on the show a few times, and she is watching and loving it. Let's see here. Lola says, I massage Radar daily and do tapping on him. He's 12 years old, Sheltie, and he acts like he's 2. He loves it. He also has a diagnosis of heart murmur, is stable with congestive heart failure. You would never know it, though. He's bouncy as ever. That's great. That just shows you right there what these techniques can do for people and for dogs. Cindy's with us also. Cindy's got lots of little doggos. They're probably being tapped on as we speak. So I'm just seeing here if there's any questions. If any of you do have any specific questions, don't hesitate a moment. Lots of questions, or lots of comments in general. People are really enjoying this conversation. I can tell that they're definitely getting a lot out of it. So I want to hand it to all of you for just, again, sharing so beautifully and so generously all the work that you do. So let me just adjust there. There we go. We can see each other a little bit better. So in closing, why don't we just tap back into tap? Now it's in my head. We'll tap to each of you and just one final word. If there's one point to remember from your conversation, what would you ideally like that to be? Chiara, go ahead.
Thank you, Amanda. And thank you, everybody. What a wonderful sharing of your experiences and also your expertise. As I was listening to everybody and I looked at some of the comments, I'd like to leave people with one thing. When you're with an animal, breathe in the animal before you start to do anything, because you're centering yourself. The animal will follow suit. And anything that you want to do, because being and doing goes together. It can't be divorced. It's a union. They will follow you. So when I start doing any type of session, whatsoever, One of the, Tina, she mentioned ask permission of the animal. She loves that. Part of that is to breathe in the animal. Where are they? So that we can both be in sync and we can move together. And it's very, very beautiful. It's a very moving, connecting experience. So I'd like to share that.
No, it's so true. And just as connecting right now, connecting with the four of us, connecting with our audience feels so good.
Yes.
Let's never forget to extend that and invite that in when dealing with our animal friends.
And actually, it's an invitation.
Yeah.
And all the modalities that we do, it's an invitation to say, let me understand you better. Let me be your voice through your body, through the emotions that you have. And just doing that is the beginning of the actual healing process using the modalities that each of us have specialized in. So it really is a key component to doing anything and beginning anything, and anyone can begin to do it, just to breathe in the animal and just start with being and then do the doing. So
That's great. Dr. John?
Well, my premise always has been physician do no harm. And one of the things that I always give our dogs, especially that come in if they're anxious or they're hurting, I always wait for them to make contact first and bring them in. Just like Chiara was saying, you need to let their space enter into your space, sometimes in respect, to let them do it first and let them have that opportunity to know that you're on their side and that you're with them. I love this work because it brings joy and relief, and it's really emotional at times. So it's good.
I think it's beautiful that you love it at that level, and that's why each of you, I know all of you love it at that level, but that's why you can heal animals.
We have a friend. I'm so sorry. Oh, my cat came to greet.
Okay. No conversation is good without a cat.
She wants to be a part of it. That was very sweet.
She knew, she loved what Dr. Harrison was saying. That's why.
Yes, she did. Apparently, yes.
She's like, thank goodness they're finally listening to the animals.
Yes. They connected. They heard us.
Oh, that's lovely. And Joan, anything you'd like to leave us with?
I feel like one of the biggest things that we're looking at right now is a lack of connection. And to me, our animal friends are that moment to connect. And that when we have that moment to connect with them, we might be able to also connect with other humans. And certainly this work keeps me connected with animals and humans in a really profound way. But it even, in the teaching, you know, getting here and connecting or online connecting, and I just think if there was ever a time where we needed to connect with nature, with ourselves, with animals, with each other, that's right now. And the animals offer us, they offer that to us. And so let's do it. Let's connect.
And you know, I think connecting to animals is really, it feeds the soul. It nourishes us. Animals are amazing at really honing in to who we are and where we're at. And they reflect that beautifully to us. And that's what I meant before when I said, when we have a session, it really is a co-creation between me, the animal, and the human. That's why breathing in the animal, connecting and asking permission, giving an invitation on their terms. So not projecting our emotions and who we think they should be, but really listening to them where they're at, so that we can meet them halfway and they can actually breathe. And through that breath, all the wonderful modalities that we have showcased here today, you know, you can see that is one of the main things. That relaxation is really about the vagus nerve and toning the vagus nerve. And sometimes what I do is I teach the human certain techniques that are used in trauma, that I use in my life transitions practice to support people going through big changes, because it tones the vagus nerve. And so we're bringing everybody down into a place where we can receive. Because for the animal to receive, their human counterpart, which is their true connection in the human world, because they spend so much time together, is key. So we're all coming base. So Joan, wonderful about the connectivity, and I agree with you, it's very much needed at this time, and the connection with nature that really is with us. My cat, she's not with us anymore, but one day she shared with me that you're a part of me and I'm a part of you. And I had to sit down for that wisdom, because it's true. They're a part of us. And there is much for them to teach and much for us to learn on both sides. So this work is very much an education on so many levels beyond the intellectual. It's amazing. So I honor all of you. It's amazing work that we're all doing.
Indeed it is. Indeed it is. And thank you all so much for that. You know, your words truly can not only help to heal one animal, help that human to heal, but these words and like planet, so individual and yet universal, and to be able to have this conversation in context of animals is extremely special. And I think it kind of takes many of us out of our head and our intellect, which we will engage more with when we're talking about other humans and trying to be and seem smart, and we with animals, because they are so innocent and so simple, that we will settle naturally into our hearts. And that's where this bond and this deep connection and the healing then can happen. And we're doing that right here today on this line. So I'm very grateful to every single one of you. Thank you.
Thank you.
Thank you.
Thank you. This was amazing. It was so wonderful to be part of. Thank you, thank you, thank you.
You're so welcome. And thank you all for watching. Many of our friends on the line, they're sharing lots of good stuff. Thank you, everyone. And thank you, Amanda. You're such a radiant energy in our animal world. Thank you, Tina. You guys are the best. Okay, we will see you at the beginning of next month, the first Saturday of April. We'll be back here together again. And until then, take care, everyone. Many blessings. Namaste.
Goodbye. Thank you.
Bye. Thank you.